Thank you very much. Distinguished CARICOM Secretary General, Dr. Carla Barnett, Dr. Jarvis Barbosa, Director of PAHO, the other members of the PAHO delegation, especially our PWR, Dr. Kim Dickinson, the other members of the CARICOM team, Dr. Lisa Yandar from CARFA, other partners who are here, ladies and gentlemen. It seems like it was just a couple of weeks ago that we were here in this secretariat, engaged in deliberations regarding the content of what should be incorporated into this strategy. And here we are today at the signing ceremony of the joint PAHO WHO CARICOM Subregional Cooperation Strategy 2025 to 2029. A transformative blueprint designed not only to strengthen our health system, but truly reimagine the future of health and well-being across the Caribbean. At its heart, this strategy is about equity, resilience, and action. It is also about our collective response to persistent health inequities, mounting climate vulnerabilities, shifting demographics, and the growing burden of non-communicable disease and, of course, communicable diseases in our region. It reflects our region's resolve to act boldly, to think creatively, and to collaborate deeply. The new joint, and I should probably say JSCS because it's a long strategy, the name of the strategy is quite long. The new JSCS does not start from scratch. It builds on a strong foundation of earlier frameworks, including the Caribbean Cooperation in Health 4, PAHO's strategic plan, the CARICOM strategic plan, 2022 to 2030, and of course, the Global Sustainable Development Goals. It is informed by lessons learned from COVID-19, which starkly exposed the fragility of our health systems. It understands that we cannot afford to do business as usual, not when our communities are disproportionately affected by hurricanes, disease outbreaks, and migration of our skilled workforce. We all know the data. We have just seen a presentation where some of this data was presented to us. We have life expectancy that is rising, which is commendable, but also at the same time, we are not investing in our health systems. Fertility rates are falling, which means that to sustain our productive population, that would be problematic as we move forward in the future, especially for many of the key sectors in our countries. And of course, the brain drain is quite real, and it threatens the sustainability of our health system delivery. Our Caribbean economies, which primarily depend on tourism, remain vulnerable to external shocks. In countries where healthcare is not free, but is provided solely through private sector or in some cases public-private partnership, high out-of-pocket expenditure can have serious consequences on a family's budget. In the light of these realities, I think the 5 priorities chart a very clear course forward. Strengthening primary health care and making sure that we have resilience in the primary health care system is quite important. What I find very significant under this heading is for the Caribbean Roadmap for Health Workforce Resilience and a new action plan on migration and mobility of healthcare workers. If we are able to accomplish this, then it probably would help to shape how we practice medicine in the region. The second pillar that we have is, of course, building climate resilience and disaster-ready health system. And here we can fall back on the tools that was used previously with smart hospitals. And these tools have helped us to build more resilient health infrastructure. And hopefully we can use what was learned there to build our future health institutions. The new Caribbean Health and Climate change action plan is, of course, very welcome once we're able to put that to use. The other big one, big pillar that we have to address is, of course, NCDs, mental health, and violence. We know that this has been a big problem, but there's light at the end of the tunnel because we have programs such as HEARTS, which PAHO has been promoting, and these programs have shown to be very effective, especially at the community level. We also have programs to help to eliminate cervical cancer. And once we can put them into use, I'm sure in a couple of years, we'll also be able to achieve cervical cancer elimination in the region. We in Guyana, one of the things that we'll be doing very soon, I think tomorrow we'll launch a new program with PAHO, and that is we'll be introducing the 9-valent HPV vaccine. And I must say to you that through the PAHO Strategic Fund, we have been able to acquire these vaccines, and they're quite affordable. So I hope that other countries in the region would use these mechanisms that are available through PAHO so that we can make the region healthier. In terms of mental health, of course, coming out of COVID, we have seen more challenges with mental health. But the direction of deinstitutionalizing patients and going more to community psychiatry, I think, is worthwhile. And we have also started moving in this direction. Violence in the Caribbean, this has been something that the heads of government has been focused on because we see more young people being involved in violence, and violence as a public health problem needs to be addressed. So I think this pillar addresses some of those concerns. Then, of course, combating communicable diseases. It's commendable that 10 countries in the region have already eliminated mother-to-child transmission of both HIV and syphilis. And this is something that we should applaud, but we should work for the other countries in the region to also accomplish this. Of course, PAHO has a very large disease elimination agenda with more than 30 different diseases that are being focused on. And this is something that we in the region, where we have such diseases, that we should also work to achieve elimination by at least 2030 or maybe slightly beyond. There are new techniques that are now becoming available to us, such as genomic surveillance, and we should use the technology so that we can improve how we eliminate some of these diseases. We also have more or newer prevention methods, and this too should be utilized. And in some cases, there are more effective treatments that are available, and we should use the strategic fund to utilize some of what is there to offer treatment to our population. Mobilizing resources and strengthening partnership. I am very pleased that one of the things under this pillar is the sub-regional framework for resource mobilization. And this is particularly important in a world now where resources are very constrained. And I think every multilateral organization is finding difficulty mobilizing adequate resources. And many of the developed countries are cutting back on their budgets to assist multilateral and countries providing resource. So while we work on mobilizing resources, we also have to look at how we can optimize and make more efficient the resources that we have in the region, and also how we make our organizations more responsive to the needs of our population. And I think this pillar adequately addresses some of that. On the technical front, of course, we have the strength of PAHO that has been with us over the years. and they have very deep technical personnel that can assist us in almost every area of public health. And we can lean on CARFA, UWI, and we also have to put in the institutions like the University of Guyana that we can lean on as well. Colleagues, I think the strategy challenges us to think long term and to act urgently and to put people at the center of our health system. It demands investment, not only in hospitals and medicine, but in human capital, in digital innovation, in community resilience, and of course, regional solidarity. It is a strategy that affirms that health is not just a service, it is a right. And in the Caribbean, that right must not be dictated by where you live, by your income, or your age. I want to sincerely thank PAHO and CARICOM and everyone who has worked together to turn this strategy into a reality. Now we need to work hard to ensure that we bring the strategy to life, and let's make sure that we deliver on all 5 of these pillars. And once we are able to do that, I think we will create a healthier, more resilient, and equitable Caribbean. Thank you.